Yeah, we're going to look at Grant's anatomy. And if you could just quickly show my anatomical bookshelf. It's the third one down from the top. And it's grossly inadequate. If you have some anatomical texts you want to donate to me, I will take them and I will use them. You simply need multiple views to understand a specific part. Anatomy is that complex. It truly is. Okay, we're going to look at some nice pictures here. This is the lateral cutaneous branch of the iliohypogastric. So it's right in the front. You see, here's the abdominal wall. This is the external oblique muscle. Here's the belly button. So if you come straight across and then drop down, and I would submit to you that the bone, the ASIS, anterior superior iliac spine, is probably right here. And this little guy here is the lateral cutaneous branch of iliohypogastric nerve. So if you come over and scratch the skin in that area and it enhances their pain, then there is a possibility that that nerve is involved. Now the ilioinguinal also shoots off a little bit of a lateral, anterolateral branch also, which in my estimation covers the TF, the skin over the tensor fasciae lata muscle. This is a subcostal nerve. This is the last one. T12 subcostal nerve. To be honest with you, that looks like the ilioinguinal to me, but it would have to enter the canal down here. So actually this is a subcostal nerve. All right, next photo. Here in lime green is the spermatic cord. Here's the opening of the inguinal canal, and it doesn't go all the way up. The upper opening is here, and you cannot go there. You can't put your finger in there. But down here, it really is surprising because it's a potential space. And once you put your finger in there, you go, oh my gosh, we have an opening in my body. It's very surprising. But there you have it. And here you have the ilioinguinal nerve innervating that spermatic cord. Okay? I need one of my colored pens. I don't have it, so let's just move on. All right, in this view, again, here you have the inguinal canal. Here you have the spermatic cord. And this is the iliohypogastric nerve. And you can see it shooting off some sensory branches to that lower abdomen. And look at how it joins up with the ilioinguinal nerve. So this is ilioinguinal right here. And this is iliohypogastric. So these guys have joined up right here, as though they were one, and then they further divided. That's pretty common. There's a wonderful article that I actually have misplaced in which a physician elaborates on that anatomical fact, and he does so with great detail. Here's another view of that inguinal canal, and this is the pubic tubercle here, a bump on the pubic bone, and the inguinal ligament goes all the way here and inserts on the medial portion of the ASIS. Out here, what do we have? What's my point? Iliohypogastric nerve is this guy up here. Okay? And then right below him and almost paralleling and almost coming out of the same sheath of the rectus is the ilioinguinal nerve. Okay? That's that point. And zipping through. Oh, here is that plexus. And in my mind's eye, I really imaged that my damage internally was to a very diffuse plexus like this, such that I did not think that there was any way to treat that pain. And injections up in the lumbar spine, upper lumbar, did not help it. I did consider a procedure where you cut the nerve very high up. I didn't think the insurance would ever cover that, and there's some clients do not actually respond well to that surgery. But I thought my injury involved this very complex plexus, lumbar and sacral plexus. Also had some injuries involving the sacral plexus, so that was not, actually have a fibrosed nerve root in the S1 nerve root, sacral nerve root. Don't need to elaborate on it, but there was a reasonable rationale why both of those might be involved. We're going to wrap this film up in about 3 minutes. Here's just another view of the same. Here is the iliohypogastric nerve, right there. And notice how it's underneath the fascia of the abdominal wall, pierces out here, and then again, look at how it pierces very, very close up above the genitalia. So you certainly can make a case for the fact that the iliohypogastric goes right above the genitalia. And then here's the ilioinguinal nerve in blue, and look at him coming out of the canal and branching out. And down here is the genitofemoral nerve, and this shoots a little branch down the thigh, and then it shoots a branch medially. So genitofemoral is comprised of two, the genital portion and the femoral portion. I'm trying to find a very good view of the iliopsoas where the nerve is formed in the psoas substance. I'm having a hard time finding that, but basically these nerves, the nerves come off the lumbar spine and then they coalesce within the substance of the psoas muscle. And here we have, this is the psoas major muscle here. And up here in green is the iliohypogastric, coming, probably up high here out of that substance at, the region of T12, L1, maybe L2. And then the ilioinguinal nerve comes down here, and they wind their way down here, and then they go traverse within or above that canal. Now the genitofemoral nerve is piercing out of the substance of the psoas muscle, and it shoots several fibers. Look at this medial branch here. And that, I believe, then comes down yonder to become the genital portion. Okay? The femoral portion is a little bit more lateral, and even he branches out. Okay? Next view. Here's another nice view of the psoas muscle. This is the iliacus muscle here. They come together and join on the hip. And then here is the psoas mass. And then here's part of that fascial sheath that contributes to and supports the inguinal canal. And then here's quadratus lumborum, has a very similar innervation. Psoas major, psoas minor has a very similar innervation as the ilioinguinal and iliohypogastric. So it's really remarkable, to my estimation at least. And here we have some of the sympathetic supply. There's the sympathetic chain. It goes down in front of the lumbar spine and then interacts with all of the plexus and such. And in this view, we have, some of those nerves that we discussed. The psoas muscle on this left side has been removed. And I'm sorry I didn't highlight the nerves. Over here on this side is genitofemoral, right there, piercing right out of there. And then this one is the genital branch. I'm sorry I didn't highlight them. Here's the femoral nerve, and ilioinguinal is up here. Do you see how it pierces? Do you see how it comes right out of an opening by the psoas, by the lateral psoas mass? So down here is the ilioinguinal nerve, and then right above it is iliohypogastric, and it traces and parallels the lowest subcostal nerve. I think that was very helpful. So on this side you have the psoas muscle, on this side it's been removed, and so you can see those nerves coming down. I think that's very helpful. I'd like one more view up here. I'd like to see it shown exactly the pathway between here and here. So that's what I'm chasing. If you've got one, I will be just delighted. Here's another view of the same. On this side, right here, that's got to be the lowest 12th thoracic intercostal. In the green here is iliohypogastric, and it doesn't show the lower portion thereof. In the blue is the ilioinguinal nerve, and again it doesn't show the lower portion. And then in the orange is genitofemoral, gives off a genital branch, and then it gives off a lateral femoral branch. Okay? Gosh, here's some more complexity. Here's another plexus. Those things are just astonishingly complex, and that has to do with primarily with the sympathetic portion of the autonomic nervous system, not to be detailed today. In terms of the skin, where you might want to do a scratch test to find out if these nerves are innervated and referring pain, you want to scratch the anterior thigh. Even where you believe it's an obturator innervation, you actually get some overflow of the genitofemoral. So look at the toes. Here's the big toe. So this is the right foot, and this is the genital branch up here on the upper thigh, and then out here is the iliohypogastric. And at the moment, I'm at a loss to show the lateral sensory branch of the genitofemoral. I'm sorry, of the ilioinguinal. Again, I stated earlier that the sensory branch of the ilioinguinal